The CARE Collaborative is a statewide initiative focused on educating individuals about blood pressure and knowing where their numbers fall. When first approached by the CHEER team, we were hesitant about fostering a partnership. We did not see how our materials could be universally adapted to benefit people with varying degrees of abilities. We thought the CARE Collaborative was basically for the average Joe. Additionally, we had preconceived notions about the extent to which our program could be suited for individuals who had any kind of limitations, such as individuals who utilize a wheelchair, as physical activity has a big emphasis within our program. Thanks to the persistence and willingness of Lindsay and the Project CHEER team to address the concerns and barriers, we agreed to pilot the project to see how the CARE program could be adapted. Since that initial meeting, our mindset has definitely changed.
I became a trained CARE coach with the intent to run the program specifically for individuals with both cognitive and mobility limitations, in order to show that with universal design and inclusion strategies or adaptations, the CARE program could be widely accessible to this underserved population, and also to show the health benefits from the CARE program that could be experienced by individuals with disabilities who have greater health issues and conditions. One example of the universal design strategies I applied to CARE is the adapted tool used during educational encounters. This revised tool, which looks similar to a thermometer, allows individuals to more easily find their blood pressure number and identify their range. This tool additionally gives CARE coaches the opportunity to provide an educational encounter. The tool's design helps to benefit people with various needs, including those who may not be able to see smaller print, who may have difficulty with numbers because of dyslexia, who may be colorblind, or who may have other intellectual or developmental disabilities. This simple tool allows for broader accessibility of the program and can be used by everyone.
In addition to broadening the scope of our educational encounter tools, partnering with Lindsay and the Project CHEER team has allowed us to reach specific individuals with cognitive and mobility limitations who may otherwise be unreached. The pilot program aimed at individuals with disabilities provided us with data that demonstrated the effectiveness of the educational encounters. There are two examples that stand out that gave us that aha moment and helped us realize that CARE Collaborative could benefit various populations.
A young man whose blood pressure was elevated enjoyed salting his food before eating. He demonstrated how many shakes of salt he used to salt his food, which looked like he was shaking a maraca. I used the CARE Educational Encounter tool to explain how salt can increase a person's blood pressure and the possible consequences of adding too much salt to one's diet. Together, we determined that only 2 shakes would be a good health goal.
When Lindsay returned to follow up several weeks later, the young man proudly demonstrated his 2 shakes hand gesture before they even had a chance to sit together and talk about how things were going. This is an excellent example of how a successful lifestyle change for this young man, and shows that even his blood pressure numbers didn't change in that short time. He was still able to remember the health messages in hopes of making a positive change. The second story that profoundly affected us was a young man's challenge in finding accessible exercise programs. He suffered a spinal cord injury as a teenager, but he does not let the mobility limitation prevent him from living an active lifestyle. Through hearing his story about persistence in finding ways to exercise, we've been encouraged to continue adapting CARE to populations with mobility limitations. The Project CHEER staff have demonstrated that with adapted exercises in space that is accessible for wheelchairs, walkers, and other mobility devices, individuals with mobility limitations greatly benefit from exercising. This exercise, in combination with education on proper diet, sets individuals up for success and improved health.
Project CHEER works to raise blood pressure awareness and develop resources on inclusion for individuals with disabilities, as well as promotes universal design and health programs and services. We work to demonstrate to individuals with varying levels of abilities that they can be active and healthy while also supporting health professionals to make their services accessible and welcoming to all. We are excited to partner with the CARE Collaborative and offer this great program universally.
We appreciate Lindsay and the team at Project CHEER for their persistence and willingness to demonstrate that the CARE Collaborative can be utilized in a broad form to reach a multitude of participants. The CARE Collaborative is not just for the average Joe. The CARE Collaborative is working alongside Project CHEER to be inclusive of all citizens in our Commonwealth, to raise awareness of hypertension, the importance of knowing your numbers, and finding ways to better control blood pressure through diet and exercise.